The health clinic is one that I think many of us are proud to be a part of that committee that's working with Merrill Green to get that done. One of the board members, I think, was concerned about not having adequate health care facilities in Southeast Greensboro. So, at his urging, I contacted a group of about 7 or 8 people. We went before the Gifford County Public Health Board and presented the case for a new health clinic. We've done a lot of work on it with the director, with Merrill Green. We made the case strong enough that we are going to get it. Merrill partnered with Moscone Health System, and there have been some bumps in the road. Still some bumps, but we're looking at things like the name for it, how many doctors we could have, how many people we would have hired. And while it's starting small, it's my hope that it will grow. But that's what happens anytime you bring something in a distressed community. You get a little bit. But we're going to get something. We're going to have a health clinic. And as a matter of fact, I just passed along an email today from Portia Shipman, who is have a domestic violence program in that building, and she's having a grand opening August the 9th. And so I'm sending an email out so people will come to it. We're excited about the health clinic and look forward to its opening. My concern was that we wouldn't have enough staff to adequately serve, or medical providers to adequately serve us. But like I say, you have to take what you can get. So that's what we're going to do. And we'll keep working at it and hope that it's so successful and will warrant its own increase in providers. Nettie Coad Apartments, that name bears that name because when it came to naming the building, the people in this neighborhood came up with the name. And I guess that was because Dorothy Brown and I lobbied so hard to save that building for something that would be useful in the community. We've had so many people that come to us, want to build a manufacturing plant and want to put social services departments in there. So we just kept, as a neighborhood, we kept defending our position that that building would be an enhancement to the neighborhood, not just another place for trucks to come in and out and, you know, not be serviceable to us as a community. So with Dorothy Barnoff, the last leg of it, because of the merger of schools, it fell in the hands of Gifford County, because the building could have been bought for $65,000 at one point, and when the city owned it, but because of the change in ownership, Dorothy Barnoff helped to lobby real hard for the city to purchase that building from the county. And then we had people in the neighborhood, Mr. Herbert Robinson, who is deceased, who worked with city staff and with Clinton Grabley, who became the architect, to look around in other communities and other cities for how they could be transformed into a housing development. And they did that, and Clinton drew up Mr. Grabley drew up the plans. And so it is a wonderful building with 30 units. There's room for expansion that we hope will happen. I would have thought we could have done it before now, but there again is the slowness of the system. The building does, tenant rents do maintain the building. We do hope to expand and build other units. There is ample room to do that. We just completed the access ramp to a basement room that will allow the people in the building a common area for doing things together that they want to do. And also the neighborhood possibly could meet in that area or, do kind of hold events. So we think it's a plus. The building is secure. It has tenants, some that have been there ever since it opened in 1990. It usually stays full. We have a wonderful manager, and the neighborhood is in charge of the management of the properties. So we're excited about that now. That was a situation where city staff, namely Mr. Scott, was a great help to the neighborhood in recognizing, after going through the racism training, the impact the building had in the neighborhood, and then who was operating it. It's in our neighborhood that he thought we should have the opportunity to manage it, and so he helped us make that happen. And it's been how many years now? I can't think of it. Was it 2000? It's been a number of years now that we've been managing it. So we want to do some capital improvements on the building. We did get a new roof. We need new windows, and we do need to do the expansion. People who live there are proud of their building, proud of the safety, the security, and so we're just proud that we held out and got something that was a major addition to the